Spotlight on America continues its in-depth look at pediatric care in America. In this report, we examine the increased risk for kids when hospital emergency rooms are not pediatric ready. We found where you go to get care for a critically ill child could mean the difference between life and death. When your child has an emergency, getting care fast is essential. But many parents don't realize the ER they go to might not be prepared to care for kids.
The majority of hospitals see fewer than 10 children per day in the emergency department, and that makes it extremely difficult to be able to maintain your pediatric skills.
Does that put children at higher risk if you're not experienced in treating children?
Absolutely.
Dr. Kate Remick is co-director of the National Pediatric Readiness Project, which evaluates emergency departments nationwide. In the latest survey, the median score was just 69 out of 100 for nearly 4,000 hospitals that responded, with a score above 83 considered high readiness.
There needs to be a deliberate focus on pediatric care. Otherwise, there's a potential to misstep.
Once they're done, then I'll come back up, okay?
Yolanda Lewis knows all too well what can go wrong when an emergency room is unprepared to care for a child.
Basically, they asked me what sickle cell was. They wasn't informed or they wasn't educated on it.
3 of her 5 kids have sickle cell disease, a blood disorder that can cause seizures and strokes and requires regular blood transfusions.
She'll have her port put in, and then blood transfusion for Kendra and Marvin today.
The family now travels an hour and a half every month from their home in Gary, Indiana, to Beacon Children's Hospital in South Bend to get the specialized care they need. But that's not always possible in an emergency. When Marvin, now 15, was little, they had a terrible scare.
I took him to the hospital close by. Nothing was wrong, they said.
Something was wrong, but the hospital discharged Marvin until Yolanda called their pediatric specialist for help.
They called back up to the hospital and they told me to take him back now.
But the confusion continued.
They didn't know how to start a transfusion. They asked me for help.
Oh my goodness.
As a parent, you're supposed to be able to rely on that hospital to do their job. Every time I take my kids to the emergency room, I risk the fear of them not knowing what to do.
Marvin ended up being life-flighted to a children's hospital in Indianapolis. This 2019 study of hospitals nationwide, published by the American Academy of Pediatrics, found a critically ill child was 4 times more likely to die when admitted to an emergency department that is not pediatric ready. If an ER is not pediatric ready, more children die.
It's absolutely true, yeah.
Dr. Kate Dukevich is the medical director at Beacon Children's Hospital, where Yolanda's kids are now treated. One of the few hospitals in northern Indiana providing pediatric specialty care.
There are not very many beds for kids, and we have seen that get a lot worse in the last several years.
About 20% of pediatric units have closed in the U.S. over the last decade, leaving community hospitals as the main option for many families. But according to the Pediatric Readiness Project, only about half of children nationwide have access to an emergency department that is pediatric ready.
Our emergency care systems were not designed with children in mind, and we need to take steps to close the gap.
Remick says more training and planning are needed because caring for kids is not the same as caring for adults.
The equipment needs to be obviously smaller. The medications are weight-based. Pediatric patients have different developmental needs. They have different physiology and anatomy.
Emergency departments are the front line of care for children.
You ready?
With fewer pediatric units open, the hope is necessity will drive progress at community hospitals for the sake of families like the Lewises. What is your greatest worry?
My greatest worry is that they won't get the care they need.
The Pediatric Readiness Project estimates that if all emergency departments in the U.S. were pediatric ready, we could save as many as 1,400 children's lives a year. For Spotlight on America, I'm Angie Moreschi. Hi, I'm National Investigative Correspondent Angie Moreschi. Thanks for watching Spotlight on America on YouTube. If you enjoy our investigative reports, please consider subscribing to our channel. And if you have a tip for a future investigation, we want to hear from you. Just send your idea to spotlight@sbgtv.com. And we'll see you next time.